Question 1. Respiratory assessment is important in Mr. Hanan's case because he has this long history of asthma and currently experiencing worsening of shortness of breath, wheezing during sleep and difficulty breathing when lying flat, which is autopnea. These symptoms may indicate an exacerbation of his respiratory condition or develop the other complication affecting his respiratory status. A comprehensive assessment helps the nurse to identify the severity of respiratory impairment by evaluating the respiratory rate, oxygen saturation, breathing pattern, lung sound, and coughing characteristic, and activity intolerance. It is also allow us to detect early deterioration and sign of respiratory distress, such as increase of work in breathing, using accessory muscle, sinus, or decrease in oxygen saturation. Furthermore, Mr. Hanan recently had upper respiratory tract infection, which may have triggered the inflammation, increased the mucus production, worsening asthma symptoms. Assess his respiratory condition, help the healthcare profession to determine the effectiveness of current oxygen therapy, monitor disease progress, and identify the need of medical intervention and therapy. Additionally, evaluating his activity tolerance produce insight in how his respiratory condition affects his inability to perform the daily activity independently. Early recognition of deterioration through a respiratory assessment can help us to prevent the complication, improvement of patient outcome, and support the development of an appropriate individual care plan. Question 2. What is the significance of performing a cough assessment for Mr. Hanan? A cough assessment is important for Mr. Hanan because it provides the valuable information about the condition of his respiratory symptoms and helps us to identify the potential complication related to his asthma. Recent upper respiratory tract infection. Assess his present frequency and severity of effectiveness of the cough as well as the characteristic of the sputum production and can help us to determine where the air inflammation, bronchospasm, infection, and or mucus accumulation is contributing his breathing difficulty. In Mr. Hanan's case, a productive cough with increased sputum may indicate ongoing infection or excessive mucus production, while a dry, persistent cough may suggest airway irritation or poor control asthma. An ineffective cough can impair the airway clearance, increase the risk of respiratory distress, and reduce the oxygenation. In Hanan's case, a productive cough with increased sputum may indicate ongoing infection or excessive mucus production, while a dry, persistent cough may suggest airway irritation or poorly controlled asthma. An ineffective cough can impair the airway clearance, increase the risk of respiratory distress, and reduce the oxygenation. Therefore, cough assessment in assisting in healthcare profession is evaluating the disease progression, planning for appropriate intervention, and monitoring the effectiveness of the treatment. Question 3. Based on the provided case scenario, the focus of respiratory assessment finding may include the first patient may appear mildly dyspnea with complaining of increasing in SOB. Second one will be oxygen saturation is 95 while he receiving 3 liters of oxygen via nasal cannula. 3. Respiratory rate may slightly elevated because of tachypneic. Next, uses of extrapilar during sleep may indicate patient having autopnea. Wheezing heard on auscultation, particularly during aspiration, suggestive airway narrowing associated with asthma. Possible of prolonged aspiration phase during the bronchial constriction, reduced air entry in same lung field secondary to the airway obstruction. No cyanosis observed but continuously monitoring is required because of the oxygen therapy. Recent history of upper respiratory tract infection and cough may be present without sputum production, requiring further assessment, and activity intolerance reduced as evidence of increased breathlessness during the daily activity.